At 3 years, I live in Jamaica still, you know. Yeah. Mona. Pleasant good morning and welcome to the Ministry of Health's update on the national COVID-19 response for Wednesday, 1st December 2021. Our panelists for this morning's update are the Honorable Terence Dialsing, Minister of Health, and Dr. Joanne Paul, Senior Pediatric Emergency Medicine Specialist at the NCRHA. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for this morning's update. Minister Dialsing will begin with the latest clinical and vaccination updates. Minister.
Thank you very much. Good morning, Al. Good morning to my colleague and friend, Dr. Joanne Paul. Good morning to ladies and gentlemen of the media. Thank you once again for joining us at one of these press conferences, and thank you to the listening and viewing members of the public wherever you are, as we account once again for our response to COVID-19. I will start with the clinical update as given by update number 924. Imagine that, 924 updates. 763 new cases reported in the last 24 hours. 71,361 total positive cases from 12th March 2020 to present. Total number of patients in hospitals, 531. Total persons recovered, thankfully, 58,363. Total active positive cases, 10,840. Total deaths, unfortunately, we had 24 reported yesterday, now stands at 2,158. And once again, we condole with the families of those 2,158 persons who unfortunately succumbed to COVID-19. There are 184 persons in our step-down facilities, 86 persons in state quarantine facilities, and 9,362 persons in home self-isolation. The vaccination numbers as of last night, close of play last night, 646,047 having received their first dose, 644,888 have received their second dose of a 2-dose regime or 1 dose of a 1-dose regime. Since we launched the additional primary doses, as of last night, 27,026 persons would have availed themselves to this. And as I said on Monday, we are accelerating that program. 82 persons have been discharged from public health facilities. Congratulations to them. 375 recovered community cases. And what we are seeing with the fatalities is what we have been mirroring for months now, that those with comorbidities, especially those with multiple comorbidities, 14 had multiple comorbidities including diabetes, hypertension, heart disease, kidney disease, asthma, cancer, and arthritis. 6 persons had one comorbidity, either diabetes or hypertension, and 4 persons had no known comorbidity. In an effort to further encourage people to take the responsible action to be vaccinated, I want to share 2 further statistics. I don't know if we have the slides. Do we have the slides out?
Not as it, sir.
Yeah?
Not as it.
Not as it. Okay, but I will still share the data with you. Hopefully we can get the slides put up. If not, I will surely make it available. When we look at the deaths since we started tracking with the... Yes, great. Total COVID-19 deaths as of November 15th, 2021, as we started to track their vaccination status. 96.2% of the persons who have died are unvaccinated. That means if you are vaccinated, you stand a much greater, better chance of surviving COVID. Only 56 who were fully vaccinated would have died, not because they were vaccinated, but because they had multiple comorbidities. The vaccination is not going to reverse your end-stage renal disease, as Dr. Joan Paul will tell you. It will not reverse your heart condition. But look at the unvaccinated, 1,411 persons. So the science is clear, the data is clear, that we really need to get vaccinated if we are to bring down the unacceptably high level of mortality. Please get vaccinated. The other slide, if it can come up, I am hoping, shows what we have been saying in the public domain with the press releases. If you look, since we started to track this data from July 22nd to November 10th, the unvaccinated account for 90.9% of patients in the parallel healthcare system. Now, in terms of numbers, because I know not everybody responds to a percentage, you want a raw number. So the raw number is this. Vaccinated persons that have passed through the parallel healthcare system is 576. But look at the unvaccinated. 5,226. Almost 10 times the amount. So again, when you look at the mortality numbers, and when you look at these gross numbers of persons passing through the parallel healthcare system, the evidence is clear. The evidence is clear. It is overwhelmingly clear that the vaccinated do a lot better than the unvaccinated. So as I close this morning's clinical update, I am hoping that these two simple slides, which shows the number of deaths amongst the unvaccinated, 1,411, versus the vaccinated, which is 56, and the number of patients in the parallel healthcare system that have passed through, 5,726 versus only 576 for the vaccinated. So I leave you at this juncture with a simple message. Don't delay. Get vaccinated today. Thank you very much, Al.
Thank you very much, Minister. And today is World AIDS Day, and we want to recognize all those persons living with the disease and remember all those who would have passed. And you would notice myself and Dr. Paul wearing red. I know
I have a slice of red.
Minister has a puff of red on his shoulder, and that is in recognition of World AIDS Day. Today we will focus on COVID-19 and children. And we have invited Dr. Joan Paul to provide us with an update. Dr. Paul.
Thank you very much, Honorable Minister, Senior Communications Officer, Ministry of Health, members of the media, ladies and gentlemen, good day. So thank you for having me again in terms of the updates with regards to children. Just to let you know, we're going to start out with two sections. I'm going to speak about the updates, and then I'm going to speak about the fact about individual choice and individual freedom. So in terms of the updates for children, we've had 65 MIS-C cases. So that's MISC, 65 MIS-C cases since last year, March to now, and those have been confirmed. Again, they have been followed up by Dr. Ronan Ramrup, who is the pediatric cardiologist. Significantly, though, since September this year, so we started to have the vaccination drive for the adolescents between 12 and 17 from August this year, 2021, but from September this year, we have had no MIS-C cases in that age group. So with the vaccination has actually stopped the MIS-C cases in that age group, 12 to 17 years old. So we have had a total of 65 but none in that 12 to 17-year-old age group since September, October, November this year, which is really, really exciting for me and Dr. Amro. In terms of the deaths so far, as the Minister has said before, we have had 4 deaths since the pandemic started with regards to children. We've had 2 of them have been 7 years old, one 13 and one 15. All of them have had separate pre-existing medical illnesses that have made them vulnerable to COVID-19. So 4 deaths so far since last year to now. In terms of numbers in the healthcare system, in the parallel healthcare system, those numbers who have been admitted, last year to now, we have had on average 320 admissions, pediatric admissions to all of the parallel health facilities in Trinidad and Tobago in total. Of those, in terms of the distribution and the trends they've seen, it's usually in 3 categories. Either we have had the babies, the less than 3 months old, who have been admitted, and they have been admitted with sepsis typically, which means that there's an infection they have in their blood. And so what happens, their immune system is a bit immature and they're young, they're small, so it's not yet developed. And with the COVID, it actually suppresses the immune system and makes them prone to having sepsis bacteria in the blood. So they usually present, the ones who have come in the hospital have been septic, especially the ones who are premature. So they have that distribution. So it's very bimodal. The next trend we have seen with those that have been admitted have been the adolescents with pre-existing medical conditions. So they have been the ones who have cardiac, obesity. They've always also been renal, sickle cell, especially sickle cell, and diabetes, and congenital disorders. So they have had something else that makes them vulnerable to COVID-19. So we've seen those 2 trends so far. The other group that have been admitted to the parallel health facilities are those who have been asymptomatic with COVID, but have had something else. For instance, they've had a fracture of their arm, etc., and they have to be seen because they're COVID positive. So we have 3 major groups so far that have been admitted. In terms of presentation, when they come to see us in hospital, as we have mentioned a few times in many health conferences, they usually present those 4 organ systems. Remember we mentioned that it's really where the receptors are. So usually they come to us with regards to brain issues. So they might have seizures, they might behave a bit strangely, drowsy, irritable, or they might not sure what they're doing, they might be behaving strangely like that. Then we have the other aspect of the heart, where they'll present with irregular heart rate or fast heart rate. And then we have the bowel, where they'll have diarrhea. So usually we have those 3 systems, a little bit less with regards to respiratory. Unlike where the adults respond to respiratory, they usually have the other systems that they present like that. And of course, the last one is where they present with sepsis in septic shock. So what can you do for your child while your child is at home? If your child is less than 6 months old, the best thing is breastfeeding. So if you can breastfeed as long as possible, that breast milk, if you're vaccinated, that breast milk will give wonderful antibodies to your child and give them some extra protection. For the older children, more than 6 months old, you have to monitor, look out for those systems we spoke about, but also monitor for when they're showing signs. Once you suspect they might have had some exposure to someone who may be COVID positive, look out for those signs, but also monitor carefully. And I say liaise with your health provider. So in terms of have a nurse or a doctor, and use your WhatsApp. It's easy now. Let's bring technology into it. WhatsApp them, send them pictures. This Oliver, Nathan, he is like this today. What do you think? Get some feedback. And if you need to, come on to the hospital to make sure your child is checked. Follow your instinct and don't delay. Okay? The other thing to do is, as Minister was saying, don't delay with regards to vaccination. If your child is above 12, go get your child vaccinated. As I've said before, we have had it where the missed cases, 0. I think that's most exciting and glaring. Between September to now, 0 missed cases in that age group, and I think that's significant enough to say I should have my child vaccinated in that age group. In terms of what else we can do for our children, we know obesity is a factor. So if your child has any of those other things, we said cardiac, diabetes, obesity, renal, etc., try as you must just to maintain their health. Try to improve their health so they'll have good physical health and vaccine health and immune health and mental health to just have them more protected if they do have COVID. The other thing I want to mention is really about individual choice and perspectives. So as an emergency medicine specialist, I know when we sit here, it seems that it's so like from a formal state, but we're also on the front line. I know the minister is, I know I am. And for instance, last week, I teach also, and I spent almost half my class counseling the senior doctors who were in my class and teaching them talking about how to cope. They're the ones who have to be working 12 hours. They have been working 2 extras. For instance, if you work 12 hours, you still have patients, because as doctors, we know we don't want to do any harm. We want to save lives. That's why we come and do this. So they work extra hours, and every shift they have someone who dies. They have to go home, and they don't sleep very well. They want to go back, and they're exhausted. So that's one perspective where we spend almost 2 hours just saying, here's how we're going to cope during this pandemic. Then I have another perspective. I spoke to one of my other colleagues, and he in the community, and they have to see persons who they know in their own community coming in and being very sick or dying. And he told me, he actually had no words. He said, there's this lady who I buy roti from every week. And I had to deal with her relative in hospital. And I had to try to save him, and I was unsuccessful. And I had to call her and tell her, hey, your relative did not make it. And at that point in time, he got silent because there's no words he can say, because it made it very real. These were people who you see all the time in our community. Then I spoke to the pediatricians, and we're on the front line also. And they're the ones who are in pediatric emergency, who have to spend hours with a child trying to resuscitate, ICU, cardiology, emergency specialists, trying to do whatever they can just to take care of your children and my children. I spoke to the pediatricians who are in Couva and Arima, and they're saying that, when they have to have the babies who are struggling there on the ventilator, they really try to do everything they can, and they have to watch them try to struggle to live, to breathe. So I'm seeing it from that perspective, and I'm also seeing it from the other perspective of the facts, as the minister was saying. If you look at a few months ago, in like February or so, we had it was clear, before we had Delta, the 2 factors that were a really major factor with regards to ICU and deaths were comorbidities and unvaccination. But if you look at it clearly now, with the Delta, the most significant factor with regards to you being in ICU or you dying is you being unvaccinated. So if we look at it clearly, there are 5 things that vaccination does. And if you want, play away and play number 5. So it's 5 things. 1, it lowers the chance of missing. It lowers your chance of getting COVID. It lowers your chance of transmitting COVID. It lowers your chance of being in ICU. And it lowers your chance of dying. So that's 5 clear, obvious things today that having your vaccine does. And the other thing I want to talk about in terms of the individual choice, you have to wait. Of course, we all understand about individual freedom, individual choice. The fact is, though, the same way, if you're a bachelor and a bachelorette, if you're by yourself, individual, you could go online, you can do whatever you want to. But if you're now married or in a relationship or have children, you now have to think about the family choice. So at that point in time, when you wait, the choice, the needs of your family, your group, overwhelms or trumps the individual choice. The same way how the community needs, at that point in time, it trumps individual choice. And the same way how collective freedom and needs trumps individual choice. So what I'm saying is that I understand about individual choice, individual needs. You have the choice. But when you wait, your choice, your community choice, your nation choice trumps everything. So I'm saying, if you're not sure about taking your vaccine, don't do it for you. Do it for the 3-month-old who's there struggling. Do it for the healthcare nurses and doctors who are there trying to cope with seeing a death every day. Do it for that pregnant woman who has COVID-19, who's not sure what's going to happen to her. Do it for those grandparents who are 85 years old, who are the ones you see in those numbers, not the faceless numbers, but the face numbers. What I'm saying is, if you don't want to do it for you, do it for us. Thank you very much.
Thank you very much, Dr. Paul. And this time we move into our question and answer segment. Our media representatives are reminded to state your name and that of the media house that you represent. You would be allowed 2 brief questions in the first instance. We ask that you identify the panelists to whom you wish to address each question. And of course, time permitting, we will accommodate a second round of questions. Also, please note that during this segment, we will be taking a few questions submitted by the Media Association of Trinidad and Tobago relating to the national response for COVID-19. Our first questions come from Guardian Media Limited. Good morning.
Morning, everyone. Rashad Khan, Guardian Media Limited. Both my questions this morning will be for Minister Dayal Singh. Minister Dayal Singh, firstly, now that, THA elections are just about a week away, is there anything special going to be done or put in place to allow those who may be positive or even in quarantine to be able to vote in that election? And my second question is, I believe it was last night that all AstraZeneca doses would have expired. Are you able to say if all of the excess doses would have been donated and found and homes found for, or do we have any on our hands which we may now need to discard? And how will we go about that if that's the case? Thank you.
Yeah, thanks. So on the issue of THA elections, I would prefer if you direct that question to the THA. On the issue of the AstraZeneca doses, yes, I got the figures this morning, Richard, and I'm looking for it. We got in 200. Richard, let me just look for it here before I quote figures, and I'll get back to you on that. I have it here somewhere, but I'll get back to you on that. If you go to the other questions, please.
Thank you very much, Minister. We now go to AZP News.
Good morning, Private Harry, AZP News. My first question is for the Minister. Minister, good morning. We have been asking for some time to get answers about, for example, the 56 people who passed away, hopefully vaccinated. What are the brand of the vaccines? One, and also I think my colleague Paula had also asked about the fatality rate in the ICU and HGU. So we have been waiting to get his answers. I don't know if they can be provided, or we can get an update with that as soon as possible.
And we have answered those questions time and time again, so I'll give you the answers again. So as both Dr. Hines and the CMO have said, the most popular vaccine in Trinidad and Tobago will be Sinopharm, over 40 to 50%, followed by AZ, followed by the others. So you will see the same spread. Question has been asked and answered several times. On the issue of ICU, Dr. Michelle Trotman was here a couple months ago, and we have echoed the answer. And we have said time and time again that patients don't go into an ICU, and Dr. Paul is here. They don't go into an ICU in a linear pattern and come out either dead or alive. They will go into an ICU. They can oscillate between different levels of care. So they could step down, they could step up, they could come out, they could go home, come back into the system. So it's not a linear progression, correct, Dr. Paul? And it's for those reasons we keep saying it is difficult to give a percentage of persons who go into an ICU because it is dynamic. You're in an ICU today, you're in an HDU tomorrow. You're in a ward, you go to a step down. You go back up to ICU, you go home, you come back in. So we have explained that, and Dr. Michelle Trotman was here explaining that. So I hope that re-emphasizes what we have been saying.
Thank you very much, Minister. We go to the Newsday newspapers for your two questions. Good morning.
Hi, good morning. This is Paula Linder from the Newsday. My two questions are for the Minister. The first one is, can we get an update on the digitalization of the vaccine verification program and the projected implementation date, if any? And my second question is, the CDC has added TNT to its level 4 COVID-19 travel advisory list. Does this concern the ministry? And also, is the government planning on banning or restricting travel from the other countries where the Omicron variant has been detected?
Yeah.
Thank you.
Thanks. Thanks. So we got in three questions here, so I'll answer all three. On the issue of digitization, that is under the management of Minister Senator Hasselbachus at the Ministry of Digital Transformation. So we are working with him. He has informed me that the actual solution is ready and has been ready, as we said in a previous press conference for a while now. What they are doing now is inputting the actual data from they are digitizing the data from the actual paper forms into a database. So as soon as Minister Bacchus gives us the go-ahead, it will be launched there. So I can't give you an exact date. I will depend on Minister Bacchus to make that announcement. On the issue of the Level 4 travel advisory, I would suggest you pose that question to my colleague, the Minister of Foreign and CARICOM Affairs, who can speak to that matter. On the issue of further travel bans, that is a decision that will be taken if necessary as conditions evolve, and the public and yourselves, your good selves, will be informed if further travel restrictions are to be implemented. Thank you very much.
And thank you again, Minister. We go back to Guardian Media Limited for a follow-up question.
Hi, morning again. Dr. Paul, I'm not sure if I missed it in your presentation, right? But when we were speaking about Miss C, you said that since September, we've not seen any cases of Miss C reported. But could you give an indication of how many children, however, within that age group would have tested positive since that time frame?
Sorry, Rashad, could you repeat the question, please?
Okay. When we were speaking about Missy, I'm not sure if I would have missed it if it was said, because we did have some audio problems. You would have mentioned, Dr. Paul, that since September, we've not had any additional cases of Missy in persons between 12 and 17 years old, right? So I'm wondering how many cases would have come out from that, of COVID-19 cases, that is, would have come out in that age group for that same period.
Thanks for that question. What I'll do is I'll check and I'll get back to you about that, because remember those pediatric cases would have been tested, swabbed, and then sent back home. So they would not be in the data with regards to those who admitted or those who have checked for MIS-C. So I will get back to you in terms of that percentage. But it's usually, in terms of the MIS-C cases that come forward, probably about 1% they've shown worldwide that have been where out of the amount tested, the amount have become MIS-C, 1 to 2%. Just to reiterate that, you're right, it wasn't just everyone. In terms of the cases, it's been those who have age group 12 to 17 years old. We have seen no cases. So I'll get our data for you and make sure I give it to Al to put forward to the media. All right, thank you.
Thank you very much, Dr. Paul. And we go to AZP for a follow-up question.
Good morning again, Minister. I just want to follow up on my questions right about the fully vaccinated people, the 56. I wanted to get the actual numbers. For example, how many died and were fully vaccinated with which brand. I understand that Sinopharm is the one most used, but we wanted to get an idea about, in terms of numbers, like 20 of this brand, 30 of this brand, like that. That is the information. I'm asking again.
So I don't have that information with me, but the message is prior. If you could put back up that slide, if you could put back up both slides, please. You see, we don't want the main message to be missed. if you could put back up both slides that I had this morning, please. Yeah, because what we are saying is that it is clear that vaccination works. That is the main message. We are not trying to blame a vaccine. This is not about vaccine blaming or vaccine shaming. The evidence around the world shows that vaccination works. 56 persons who were fully vaccinated have unfortunately passed, but 1,411 who are unvaccinated have unfortunately died. And that is the evidence around the world, and I don't think anybody around the world is collecting evidence or data on vaccine correlated with death. To answer your previous question, I just got the information about the AstraZeneca. So we would have brought into the country 277,200 doses of AstraZeneca. As of yesterday, the expired amount, and bear in mind that the AstraZeneca, as I indicated on Monday, the vials come with overages. Sometimes you get 1 dose extra or 2 doses extra. So what has been left are those overages, 1,870, which is 0.67% of the total amount issued. So we got in 277,200, and only of that 0.67% or 1,870 would have expired, which is really, really good. It means almost all, 99.3% of the AstraZeneca doses have been used, which is absolutely phenomenal. Thank you very much, Prior.
Thank you. And we go to TTT for your questions.
Hi, good morning. Sunil Lala from TTT News. Minister, since we're putting the restrictions on these several countries that because of the Omicron variant and so on, have we seen any nationals coming so far? And any updates on the Omicron variant in terms of, I note that the NBC, Sky News, and a couple of them as well have said that initial reports suggest that it may be more mild. Can you give us any updates or anything you have on the Omicron variant as well?
Yeah. So both Dr. Paul and I will take that. So as we always do, as soon as we have discovered any variant, including the Omicron, we will come to you with the information. As soon as it happens, you will be the second to know, right? As we have always done, whether it's Delta, Alpha, whatever. The University of the West Indies, as they always do, will contact us immediately upon getting their first case. Now, it doesn't mean that the Omicron variant isn't in Trinidad and Tobago or anywhere else. It just means we haven't detected it as yet. If you would recall, our first Delta case, I believe, was a Venezuelan national, and then 1 day later we got it in a Trinidadian. So it doesn't mean that case 1, when we first identified it, is the first person to have it. It's just that that was the first person to be discovered with it. So we will come to you as soon as we have it. On the issue you are asking about milder disease, I just want to inform the population, and we'll go to Dr. Paul. A lot is not yet scientifically known based on evidence about Omicron, whether it's more transmissible, it seems to be more transmissible, severity of disease, immune escape, vaccine escape. But I will let Dr. Paul take it up from there now.
Thank you, Minister, Honorable Minister. Just to piggyback from that, so confirming a few things. It was picked up, identified in South Africa first. But the thing is that what they found is that although it was identified there, it already had reached various areas, as we know, Nigeria, Europe, and also US. So we think, as the minister is saying, it's probably, if it hasn't reached Trinidad yet, it may reach soon. So it's very, very transmissible. Significantly, with the mutation, it's almost like having a separate virus. It's like having a separate COVID-19 virus again. And therefore, the worry is that it may not be picked up by our immune system, and it might partially be responsive to vaccines. The thing is that, because we did liaise with Professor Michelle Montai beforehand, and she has been liaising with her colleagues in South Africa, and they have confirmed what they have seen there is that it's mild infection. And in fact, that's the trajectory of how these pandemics go. You have the peak, the worst variant, and then afterwards it becomes milder and milder, and our immune system becomes stronger and stronger to it. So we may turn the corner from this or may not. I think what we have to see, though, is a response to the different populations. So it might be milder so far with those small amounts in South Africa, but we have to see how it responds to the European population, US, and also the Caribbean population. So I've been telling persons to watch and wait. It might be that, definitely more transmissible. It's going to be the dominant variant. Once it comes, it will take over Delta, for sure. But I think we have to watch carefully. And in the meanwhile, I would reinforce, if you're not sure what's coming down the road, you're watching that dark corner and you're thinking, I would say, let's get the protection. Let's lock the doors. Let's get everything ready. And I would say, let's try having our health being improved, having our physical health improved, and having our vaccination health be improved, our vaccine health. We're not sure about Omicron. More data is coming in. Every day I peruse all the information to make sure I'm as aware I'll be able to transmit the information to you. But in the meanwhile, get your layers, get your sword and your shield, take your vaccine, so no matter how it comes, you'll be able to fight it, even if it's better or worse. But so far, confirming that, it's been showing milder symptoms, but we have to wait and see. Yeah.
Thank you, Dr. Paul. Very well put. Sword and shield. I have mine. Do you have yours? We go to the Newsday for your follow-up question. Good day.
Good day. So my next question is, what is the current level of vaccination among nurses? If you could give us an update on that.
Yeah, thanks. So the current estimated level of vaccination amongst nurses is about 60 to 65%. Doctors, medical doctors, we had reached somewhere between 95 to 98% of them very early in the game. The nursing fraternity was lagging, and we continue to work through the RHAs to give them the information and encourage them to be vaccinated. So the current estimated uptake among the nursing fraternity is 60 to 65%.
Thank you, Minister. We will now take some questions that would have come in from Matt. The first question is, South African scientists detected the B11529 Omicron variant on November 25th. Do we have the resources, and are we testing for unique variants that may turn up in Trinidad and Tobago?
Thanks. So I will take that, yes. So we started testing for unique variants through the University of the West Indies. Professor Christine Carrington has been here several times. She works at that lab. So yes, we have the capability to test for the Omicron variant. Additionally, CARFA is also building some capacity to do testing for variants of concern. So the basic answer is yes, we do have the capability. The Ministry of Health a few months ago would have assisted the molecular biology lab where Professor Carrington operates from with a $500,000 cash injection to purchase extra capacity. I visited the lab to see the machinery that was actually bought. And with that injection of cash, they were able to increase by a factor of about 20 the number of samples they could run at any one time. So they have capacity, and as I said, CARFA is now starting to build some capacity, right? So we do have the capacity. Thank you very much.
Right, this question goes back to you, Minister. Again from Matt. When will the government and Minister of Labour announce legal guidelines allowing employers to mandate employee vaccination without sanction by the industrial court?
Okay, so that is a question I think best posed to the Minister of Labour and also the cabinet led by the Honourable Prime Minister. That is not within the domain of my narrow sphere of responsibility as Ministry of Health, as Minister of Health.
Understood. Further question, what should one do if they receive a positive diagnosis? Can they treat at home if symptoms are not severe?
Yeah.
What does the treatment look like?
Sure.
Does the MOH recommend a second test if the first is positive?
Dr. Paul.
Thank you for that. I'll answer that. So if you have been confirmed positive, that's PCR positive by a reputable lab, what you're going to do is monitor yourself. It doesn't make sense if you are mildly symptomatic or asymptomatic. It doesn't make sense to rush off to anywhere. So a few things you do. Make sure you have your vitamin C being taken. Make sure you have lots of fluids. Rehydrate very, very often. Make sure, the thing is also about COVID, it can cause inflammation in terms of all the organs. It affects your pancreas. So you also don't want to be eating too many sweet things, especially with pre-diabetics. So make sure you are being optimum, eating your normal healthy diet. Have some exercise though, in terms of mild exercise. Don't just stay indoors. Quarantine yourself, obviously, from the rest of your family. So I'm talking about make sure maintain your health. You're resting, mild physical activity, vitamin C, drinking lots of fluids, checking your temperature, paracetamol and ibuprofen, and monitor. Make sure you have your portable oxygen monitor, so your oximeter, which you can get in any pharmacy. Make sure you have one. So what I usually tell persons is that take your vital signs, be your own nurse and doctor at home. Take your vital signs about 3 or 4 times a day. Check your heart rate, write it down. Check your oxygen level. Check your breathing. Check in with yourself to see how you are. Take your fluids, see what's happening. You might have some brain fog. You might, with the COVID, you might be a little bit, you mightn't be as fast and cognitively strong as you were before. So just be patient with that and monitor yourself day 1, day 2, day 2, and make sure you quarantine from your persons. If you find that at any time you're having your shortness of breath, you're breathing a little bit faster, you find your fever has gone up with that, you're feeling much worse and your oxygen level is going down. So usually we be optimized about anything above 94, 95 is fine. If you start to go down, make sure you've been liaising with, again, your body nurse. Have your body nurse or doctor, you've been WhatsApping and saying what's happening. And if you need to, call 811 and go to let the ambulance come pick you up if you find that. So of course we know that we're having lots of cases right now in the middle of the surge. If you find that you have been waiting for a while, you want to go, you can have a relative come and they sit in the front of the car and you're in the back. Make sure they have their PPE on and you have the windows open so you don't have them exposed, and you go to a health facility to be checked up. So you monitor carefully. If you see deteriorating, do not wait. I know we've been hearing stories that we're inundated. The fact is that what's been happening is that persons have been waiting and using other forms of medication, whatever it is, and then coming at the last moment. And then having those doctors just try everything possible to save them. Don't wait till the last moment. Make sure and monitor. And if you find you're going down with your oxygen saturation, so check oxygen level, shortness of breath level, heart rate, respiratory rate, and how you're fluid and how you're feeling yourself, then go check yourself at the health facility. Thank you.
Thank you very much, Minister and Dr. Paul. Okay, so we have another question coming in. The public interest. In the public interest, and given the constitutional right to freedom of the press, will the ministry grant access by a reporter, upon request, to a hospital ward where COVID-19 patients are being kept, of course, equipped with the appropriate PPE, so that the media can witness and report accurately on the experiences of citizens and frontline workers?
Thank you. So the Ministry of Health does not own nor operate the hospitals. All hospitals are the property of the RHAs. So the Ministry of Health, as Dr. Paul will know, has no authority to grant access to the hospitals by the media. That is up to the individual RHAs. So RHAs in the past and during COVID have done so. What simply needs to happen is that the request be sent to the CEO of the appropriate RHA, and once you have sign-off by the CEO, the Chief of Staff, and Dr. Paul will go into it more, and also the patients, once you have their permission, it is something that the RHAs can grant, not the Ministry of Health. Let Dr. Paul go a little bit further.
Just to add to that, we've already had some media personnel go to the RHAs and various of the ICUs and the COVID health facilities. So it's definitely via the CEOs. Once they've given permission, they can give access. We've had, I think, on the program Homefront, plus a few other television stations have gone in, have done some pieces there with permission. And so it's not a problem at all. It's totally transparent. We are trying to, of course, you have to balance that with confidentiality with the patient. So as we're trying to make sure we see and know what's going on, we also have to protect the patient's privacy. So once the CEO and the team are fine with that, that's no problem at all. Thank you.
Thank you very much, Dr. Paul. We go to Guardian Media Limited for a follow-up question.
Morning again. Minister, do you have an update for us on the Under-19 Cricket World Cup that is supposed to be happening in Trinidad and Tobago next month?
No, I don't. I would suggest you pose that question to the authorities who are hosting that tournament. Thank you, Richard.
Thank you, Minister. AZP, we're ready for your follow-up question.
Good morning again. My question is for Dr. Paul. Dr. Paul, the children who were 12 to 17 that tested positive, can you say if any of them were fully vaccinated, and what is the contact tracing showing? Where have they contracted the COVID-19? Is it at home or is it at schools, etc.? Thank you.
Thanks for that. Definitely the ones who, out of the 4 who died, 2 were 7 years old, and 1 was 13, 1 was 15, and all the ones who are over 12 were unvaccinated. With regards to in terms of contact tracing, for sure, we've seen most of the contacts being at home, for sure, in terms of having families. So usually it's families who come forth, being entire families who are coming to be ill. So usually the parents will be ill first, then we test the children and they have COVID-19. So that's the usual connection there, and not primarily the schools per se, but primarily the households. This has been the same for even the healthcare providers and most of the other groups. You've found that the pockets from the home to serve the household. So what you really want to reiterate in the household is that if you have a relative there who is COVID positive, well, first of all, one, try to have all your family members vaccinated. As I mentioned before, you transmit less. So if you're vaxxed, there's a lower chance of you having it getting it from your person in the hospital in the area who is COVID positive. So get vaxxed first. And the second thing, try to maintain those quarantine rules, because for sure in that environment there is much more chance for it to be transferred. And you also keep your windows open, not at nights, but try to have that fresh air moving all the time so that you have less viral particles staying in a closed environment. So air passing through, having your quarantine rules, and getting yourself vaccinated. But definitely from the household as a major source. Thank you.
Thank you very much, Dr. Paul. We go to Newsday for your follow-up question.
Hi, good day again. Minister, you've been advocating for people to get their flu vaccines. Have we seen any new flus floating around? Are people presenting with symptoms?
Sure, I'll take that one also. So we'll definitely be seeing a few patients coming in with flu. It's not so much the adults yet. Typically, you have not the general adult population, but you have it with the older persons and you have it with the children. So at the pediatric emergency department and most of the emergency departments where we've been seeing children come through, they've been having a mixture of influenza and COVID-19 of those who have those symptomatology. In terms of the older persons, we've been seeing that also where they have been having flu-like symptoms, and when you test them, it's not COVID, it's actually influenza itself. So we've been having, again, that bimodal distribution as we usually would do. But remember the adult persons, the reason why we push for influenza vaccination or flu vaccines is not just to protect yourself as a general adult between, say, 30 and 60 years old. Is also to protect those two groups on both sides, trying to make sure that you don't get the flu to pass it on to them. So we have been seeing persons with influenza and also in addition to the mixture of COVID-19 cases. Thank you.
Thank you very much, Dr. Paul. We go now to the Guardian Media Limited. Another follow-up question.
I have to say this is a weird feeling having so many questions to be able to ask today. But Minister, do you have any update for us on the booster campaign that you would have stated? Do we know anything further on where that planning process has reached and when we may get some more definitive word about it?
So Richard, you can't complain today, eh? You can't complain today. Okay, so as I said on Monday, before you launch a booster program, you must have all the physical infrastructure in place. So we were working towards that. We have a strategic stock of 690,000 vaccines. 2, we had to build, because you not only need vaccines, you need all the consumables. So you have to build up a strategic stock. So when you go into a vaccine site, as you have been, Richard, you see those sharps, the red plastic containers they put the needles into. You have to build up a stock of that because that is disposable. So we built up a stock of 21,903. Alcohol pads, you build up a stock of 1.1 million. The needles, we built up a stock of 1,644,000 to do that. But then you don't want your normal vaccination program to collapse. So you build up a strategic stock of 1,250,000 of other vaccine syringes for MMR, yellow fever, and so on. So, to launch the booster program, 1, you need the policy. So we are going to do it, as I said on Monday. The actual details will be announced within a week or 2. We have the vaccines. We brought in recently 234,000 doses of vaccines, 84,000 Sinopharm, and 150,000 J&J. We have built up the stock of all these consumables, millions of units. If I count them up here, it's about 3 million units of consumables to launch this program. Because what you are doing is basically revaccinating over 600,000 people who may want to access it. So the vaccines are there, consumables are there. We had a meeting with the CEOs yesterday. We're having a further meeting with the general manager of nursing, all the primary healthcare physicians on Friday to give them the blueprint. Once that is signed and settled, we will have more details for the public and yourselves as to how we're going to roll it out. So what is being worked on now is the mechanics after we have built up the strategic stock of vaccines and consumables and policy. Thank you, Richard.
Thank you, Minister. We want to go back to you for closing remarks. Yes.
Thanks. Thank you. Thank you, ladies and gentlemen. I know today was a weird feeling. Everybody got to ask 4 or 5 questions, which is good. I'm not complaining. Ladies and gentlemen, as we come into the Christmas season again, the evidence is clear. The evidence is overwhelming that vaccines are going to save your lives. Don't take it from me. I think we have 2 clips, Al.
Yes, we do.
I spent some time at the paddock yesterday, because in talking to my friends in the media, they say, you know, the minister can say so much, Dr. Paul can say so much, but a lot of media practitioners, and I listen to them, they say we want to hear from the man in the street. So we are going to play 2 clips for you now of people who were vaccinated yesterday at the paddock. And I am hoping this convinces the man in the street, the man in the maxi taxi, the market vendor, everybody to let's get vaccinated. Thank you, Al.
Minister. So we'll now go to those 2 short clips.
I'm Akima Brown. I'm from St. James.
And I, Julian Agatha from Jacob.
I'm taking the vaccine today because I have a little sister that I will do anything for, and to make sure she's protected and making sure I'm taking the vaccine.
And I take the vaccine because I want to get a new job, I don't want to go back soon, and I'm taking it because of her. I want to protect myself too.
Don't delay. Get vaccinated today.
Hi, my name is Marlon Ambrose, and I'm from Oscuro, Samoa. I decided to bring my son to take the vaccine because, one, the pandemic is real, and typically, as much as you want to have it in a controlled environment and control things, the reality is when things reach home and close friends, family, you know, you see people die from this virus. You know, you tend to consider the bigger picture of things.
Don't delay. Get vaccinated today.
Thank you very much, ladies and gentlemen. In closing, we ask that you please continue to protect yourself and your loved ones. And for up-to-date and reliable information on COVID-19, please go to the Ministry of Health's website. It's www.health.gov.tt, or visit our social media handles. If you haven't received your COVID-19 vaccination as yet, please get yours now. Don't delay. Vaccinate today. Be safe, and goodbye for now.